Now, the past winter was a heavy one for respiratory viruses dominated by surges of RSV, influenza, and COVID-19. But just as it was winding down, a little known virus that causes many of the same symptoms, a lower lung infection, hacking cough, runny nose, sore throat, and fever, was just picking up steam. Now, let us look into the recent outbreak of the human metapneumovirus HMPV in China, which raises huge public health concerns lately due to its parallel timing and symptoms with the COVID-19 pandemic, but more severe than COVID-19. Now, the human metapneumovirus HMPV, which was first identified in June 2001 in the Netherlands by a team of researchers led by Bernadette G. van den Hoogen, they discovered this novel virus while studying respiratory infections in children, specifically in samples from 28 children with unexplained respiratory infections. Now, despite being discovered in 2001, no treatment is yet known for the HMPV, even after 24 years. Now, although officially recognized in 2001, studies suggest that the HMPV may have been circulating for decades, possibly since as early as 1958. Now, the HMPV belongs to the Pneumoviridae family and it's genetically related to the avian metapneumovirus. Now, it primarily spreads through respiratory droplets and can cause a range of illness from mild upper respiratory infections to severe pneumonia, especially in vulnerable populations like infants and the elderly. Now, blood tests indicates that most children have had it by the age of 5. A 2020 study in the Lancet Global Health estimated that among the children younger than 5, there were more than 14 million HMPV infections in 2018, more than 600,000 hospitalizations, and more than 16,000 deaths as we enter 2025. Now, the northern China is experiencing a significant surge in the HMPV cases, particularly among children under 14 and seniors who are most considered vulnerable to these infections. Now, images of overcrowded hospitals circulating the social media raise public concerns, reminding us of the chaotic early days of the COVID-19 pandemic. Now, despite coincides with winter, a season known for increased respiratory infections. Despite these alarming developments, the Chinese authorities have downplayed the outbreak as a typical seasonal occurrence, asserting that the respiratory infection peak during winter and that the situation is manageable. Now, this current situation draws huge comparison to the COVID-19 pandemic that began 5 years ago. COVID-19 emerged in December 2019 in Wuhan, China, led to global health crisis that resulted in over 7 million deaths worldwide. Even though the World Health Organization had yet declared a global emergency regarding the HMPV, neighboring countries like Hong Kong and Malaysia monitor the situation closely for potential cross-border transmission. Now, experts warn that Africa should also prepare proactively. Now, this is the reason you're watching this. Because we all know historically Africa has faced challenges during global health crises due to severe factors like inadequate healthcare resources, brain drain leading to human resources shortage, financial barriers, governance issues, and extensive travel connections. Nigeria, one of the major economic hubs in the continent, must take preventive measures against HMPV and other respiratory infections. Now, experts emphasize that it is not solely the responsibility of government or international bodies to safeguard public health. It is crucial for individuals and communities in Nigeria to adopt specific preventive strategies such as regular hand washing, of course, the use of soap and water frequently, wearing face masks, especially in crowded or enclosed spaces, stay informed and updated about vaccines for respiratory illness, and importantly, seek medical attention when necessary. Now, while the outbreak of the HMPV in China raises valid concerns reminding us of the past pandemic like COVID-19, it is also a reminder for nations worldwide, especially those with vulnerable health systems, to remain vigilant and prepared. Well, until I see you next time, stay safe and stay informed. Bye-bye.